This is part 4, the last section of Emergency Room and Trauma lesson. This lesson will cover other potential traumatic injuries. Spinal cord injuries. They may be complete or incomplete. Often results in loss of motor function, sensation, reflexes, and bowel and bladder control. May be injured by direct force to vertebral column or penetrating trauma. The cord can also be injured via contusion, compression, laceration, or by severing the cord. This image depicts specific nerves and their area of location in relation to the spine. We have primary spinal cord injury, which includes hyperflexion or hyperextension, axial loading such as vertical compression, excessive rotation, or penetrating injuries. Secondary spinal cord injury worsens the primary injury. It can be caused from hemorrhage such as bleeding into the white or gray matter. There could be a result of ischemia due to lack of blood flow. There is potential for hypovolemia, which results from the hemorrhage and the loss of blood vessels tone. And they may even experience neurogenic shock, and that's a result from the hypovolemic shock. Levels of injury and the extent of paralysis are dependent on location of the injury. Dysfunctions are also related to nerves that are also injured with the trauma. So let's discuss some complications. Complications include spinal shock, which is complete but temporary loss of all muscle, sensory, reflex, and autonomic function below the level of injury. It may go away after 48 hours, or it may last up for weeks. We also have neurogenic shock. This occurs within 24 hours after an injury. It's more common in injuries that are above the T6. It can be caused from failed communication between the upper and lower motor neurons. Then we have autonomic dysreflexia. This is a massive sympathetic response to noxious stimuli, leading to bradycardia, hypertension, facial flushing, and headache. Treatment is to remove the noxious stimulus. Chest trauma can consist of pulmonary contusion, rib fractures, flail chest, pneumothorax or tension pneumo or hemothorax, or a tracheobronchial trauma. Cardiac injuries can include penetrating cardiac injuries. Pre-hospital mortality is high. There's cardiac tamponade. That's an accumulation of blood in the pericardial sac. Treatment is pericardiocentesis. With cardiac tamponade, you have to do an emergency pericardiocentesis and then figure out the source of bleeding and stop it to prevent this from happening again. Vascular injuries can be aneurysms or broken vessels. Then we have the abdominal trauma. This is injury from the diaphragm to the pelvis. It can be from a blunt force, penetrating injuries, or contact sports injuries. It may include the large or small bowel, the liver, the spleen, the duodenum, the pancreas, the kidneys, or the bladder. The assessment for abdominal trauma would include to look for distension, look for bruising, auscultate bowel sounds, may need a CT scan or an ultrasound. We also have the Cullen sign and the Gray-Turner sign, and you want to check for rebound tenderness and rigidity. There's also the Kerr sign. There may be subcutaneous emphysema, and they may need a peritoneal lavage, and you want to check for hematuria. After head injuries, pelvic fractures are the second most common cause of death by trauma. They may result from crashes or from falls, especially in the elderly. The pelvis is very vascular and contains major organs and blood vessels. Major complication can be bleeding or hypovolemic shock. Classification will depend on weight bearing, such as multiple fractures of the pelvic ring or fractured acetabulum may require external fixation or open reduction with internal fixation. It may require traction. There might be weight bearing again within a few days or as late as 12 weeks. Non-weight bearing is usually involvement of the pubic rami or the iliac crest, and treatment is bed rest on a firm mattress or bedboard, and they usually heal in 2 months. Other complications of trauma include infection or sepsis, pain, renal complications, burns, compartment syndrome, a DVT, fractures of extremities, an amputation, shock, multiple organ dysfunction syndrome, or death. This completes the lessons on emergency room and trauma parts 1 through 4. If you have any questions related to these lessons' content, contact the instructor.